Hello, my name is Gabrielle Saunders. For the purposes of this presentation, I will be assuming the role of an Air Force officer in a public health unit. Now, as fellow officers in the public health unit of the Air Force, will be a briefing for you on the analysis of healthcare in comparison between Italy and the United States. The 5 indicators of healthcare status to be discussed include health outcomes, long-term care, current threats to the healthcare system, including COVID-19, the cost of the healthcare system, and insurance mechanisms. To begin, I just wanted to brief you on the health outcomes in comparison between Italy and the United States. So in Italy, the infant mortality rate is 2.7 deaths per 1,000 live births. This is in comparison to the rate in the United States of 5.6 deaths per 1,000 births. And in Italy, there are inequalities between regions. Specifically in southern Italy, the rate is much higher than in northern Italy. And it's been suggested that maternal care should actually be added to the welfare system so that everyone, including documented immigrants, can benefit under the universal healthcare system. In terms of life expectancy, in Italy, it's 86 years for women and 81.9 years for men. In the United States, it's an average of 78.5 years. So in Italy, life expectancy is slightly longer. In the United States, actually, life expectancy and other health indices are lacking among developed nations, including other nations. In Italy, life expectancy is dramatically increased in the 1900s, and Italy's actually leveled out in terms of population growth between birth and death rates. Vaccination rates in both countries are relatively similar. The only exception being that the flu vaccination rate in Italy for adults over 65 is 53.1% in comparison to 68.7% in the United States. So you can see that the flu vaccination rate in the United States is actually much higher in terms of elderly adults. Long-term care in Italy, so there's a shortage of long-term care options, which is causing those who are severely disabled to actually remain at home because there's a need for more long-term care facilities and an increase in the quality of care in those facilities. Italy actually has an aging population in general, and the long-term care facility system is underdeveloped and unequipped to deal with these aging elderly. There was actually a study done in Italy that found that the elderly have many comorbidities and severe limitations in their activities of daily living. And also, the study found that the majority of nursing home residents suffer from dementia. This can be compared to the United States. In the United States, elderly individuals, so there's also a lack of care for elderly individuals in the United States, so that's a similarity. But to address long-term care issues, the United States has turned to unlicensed care homes, UCHs, as cheaper options. Most of these are illegal and not registered. Some are legal by state and some are completely unlicensed. And because they're not licensed, they can't be tracked and they can't be found as well. Now, some of these UCHs allow patients with drug abuse and behavioral issues, which is a practical alternative for these patients. And some of them are actually cheaper as well, so that's why people turn to these facilities. But as more people in the U.S. are becoming Medicaid beneficiaries, the country still needs to focus on providing licensed, affordable options. In terms of care for older adults, Medicare is increasingly providing long-term care benefits, but it's still unaffordable. So it's suggested to increase Medicare's coverage while allowing time for the private insurance markets to expand and develop. That would actually provide for immediate needs while allowing a sustainable finance system to develop in the meantime. Regarding current threats to the healthcare system, the major current threat to the healthcare system worldwide is the COVID-19 pandemic. Now, there are several factors to keep in mind when just regarding Italy. Italy was entirely unprepared for the COVID-19 pandemic, as well as the rest of the world. Now, Italy lacked the infrastructure and the employees to deal with the pandemic. And because of this, there are disparities in infection rates among healthcare workers. The disparities are found based on region, although the Italian Ministry of Health is currently focusing on reducing health inequities. Current care for COVID-19 in Italy focuses first on containing the virus and second on providing supportive care. In terms of provision of supportive care, Italy is trying to increase communication between patients and their families, and just to find several new strategies to do so. Also, it wants to provide emotional care and then to increase the bonds between healthcare providers and healthcare workers to provide a sense of camaraderie during the pandemic. Now, during the pandemic, there are other healthcare issues in Italy that have fallen to the back burner, like obesity, which are exacerbated by the pandemic. It was found that childhood obesity has increased due to the pandemic. Research shows, specifically due to new lifestyle habits, there's an increase in intake of potato chips, red meat, and sugary drink, without a corresponding increase of fruit and vegetable increase. And there was also a decrease in exercise, an increase in screen time, and an increase in overall sleep time noted. So the pandemic patterns need to be realized in order to begin the efforts to combat them. In the United States, similarly, the COVID-19 pandemic wreaked havoc upon the country. At the end of 2020, there were more than 20 million infections and 346,000 deaths in the United States. Specifically, there was a new surge in cases that began at the end of November 2020 that caused officials to be afraid for holiday travels. There are challenges in providing the vaccine, and the United States failed to meet its goal in giving the initial dose of vaccine to 20 million residents by the end of the year. COVID-19 was declared a pandemic by the WHO on March 11th in 2020, and 2 days later, the American president declared it a national emergency, and then shortly thereafter implemented a travel ban on non-citizens traveling from Europe. On the date of 2020, March 27th, President Donald Trump signed into law the CARES Act, that provided $2 trillion of aid to relevant hospitals and businesses. So the United States mobilized and took precautions relatively quickly after the pandemic was declared. Next, I wanted to brief you on the cost of the healthcare system. Italy uses a low-cost business model in providing healthcare. This model maximizes profit while providing for overall societal needs at the same time. It's considered to be quite advanced and is being adopted by other developed countries. So Italy is the model of the healthcare system in terms of costs. The Tuscany region has 3.6 million inhabitants and spends 6.1 million euros on public health. Now there are 12 local health authorities responsible for public health, and the government uses a multidimensional approach to monitor these achievements in public health. If the goals of the authorities include financial sustainability, provision of the best possible care, and maximization of productivity. And if these goals are achieved, the healthcare budget could be reduced by 2.7%. Also, as of 2017, yearly healthcare spending in Italy was $3,376 per capita. This includes an out-of-pocket expense of $793. This can be compared to the United States, where healthcare spending was $10,207 per capita, which includes an out-of-pocket expense of $1,122. In the United States, healthcare costs have recently skyrocketed. 90% of older adults are afraid that these costs will stay the same or become exacerbated, and 7.5 million older adults cannot afford at least one of their medications. Medicare beneficiaries actually spend about a quarter of their yearly income on healthcare. And for all the money spent on healthcare, the United States is still lagging behind other countries. Americans have the most expensive healthcare in the world, and as of 2017, the United States spent $10,739 per person on healthcare. Employers spend over $800 billion on healthcare, and at the rate this spending is increasing, by 2040, employers will spend $2 trillion on healthcare. The last indicator I wanted to brief you on is insurance mechanisms. Italy relies on universal insurance provided by the government mainly. It has both public free health insurance and private health insurance, which is paid for separately, and it has a social security and welfare system. Care is provided by a locally based national health care system, NHS, that provides universal coverage by requiring citizens to register by selecting a general practitioner. So when Italians have a health problem, they first have to go see their general practitioner and then are referred to specialists from there. The NHS universal healthcare system is not without flaws, mainly being that it's heterogeneous and it's fragmented. So there are inconsistencies in care. Not all immigrants register with the NHS, and undocumented immigrants, of course, do not register. This means that immigrants don't receive proper health care, and hospitals become their only option for care because they're not actually treated for preventative care. In comparison to Italy's healthcare system, rather in contrast, the United States relies on private insurance and has no public health insurance other than Medicaid for the unemployed and Medicare for the retired. Private health insurance is obtained through employers, and then Medicare and Medicaid provided by the government are paid for by money set aside that citizens pay for when they pay taxes. Certain health issues are more common in the United States is uninsured, which is possibly due to the lack of preventative care. Specifically, pediatric acute kidney injury happens more often in racial minorities and in the uninsured, and additionally, lack of insurance is the biggest sociodemographic risk factor for AKI. It has been found that one case of AKI could be avoided if 70 uninsured hospitalized children were given Medicaid. In the United States, those who have a limited proficiency in the English language have a lack of health insurance disproportionately and a lack of health care as a result. After the Affordable Care Act, Obamacare, was passed in 2010, some of these disparities were actually lessened. Now, as you can see, this has been a briefing on the healthcare system in Italy in comparison to the healthcare system in the United States. And here are just the references used in this presentation. Thank you for listening.